Hello, I'm Dr. Victoria Basie, Medical Affairs Manager at Pfizer Limited UK. I'd like to present this study on the risk of venous thromboembolism in atopic dermatitis, a matched cohort analysis in UK primary care, on behalf of my fellow authors, Professor Richard Warren, Dr. Anita Lynham, Dr. Charlotte Curtis, and Professor Michael Arden-Jones. Inflammation is a central part of many conditions, such as psoriasis, inflammatory bowel disease, and rheumatoid arthritis. In these conditions, the inflammation is known to increase the risk of blood clots. These blood clots, or venous thromboemboli, are known as deep vein thrombosis, or DVT, when they occur in the leg, or pulmonary embolism, PE, when they occur in the lungs. Atopic dermatitis, known more commonly as eczema, is also an inflammatory condition. With this study, we aim to establish whether AD is also associated with an increased risk of blood clots. We also aim to evaluate whether risk for blood clots associated with AD varies by the severity of AD, and whether the risk varied by patient factors, such as sex, age, obesity, use of contraceptives containing estrogen, and the presence of allergic conditions. We used anonymised primary care medical records from 700 general practice surgeries across the UK. The study period covered 10 years, from January 2010 to January 2020. From the GP data, we identified adults with active AD using their diagnosis and treatment records. AD was classified as mild, moderate, or severe, depending on the management approach which had been used to treat it. We matched each person with AD to 4 unaffected control, which had never been diagnosed with AD, to act as a comparison group. These matched controls were the same age and sex as those with AD and registered with the same GP practice. The study outcome was a recorded diagnosis of a blood clot, either a pulmonary embolism or a deep vein thrombosis, during a maximum of 10 years of follow-up. When comparing the total number of blood clots diagnosed in people with AD and those without, we found that the number of new recorded cases of blood clots were higher in people with AD, shown in red, than those without AD, shown in blue. At 10 years, the risk for blood clots in people with AD was 2.5% compared to 1.9% in the controls without AD. There was no evidence that blood clot risk differed by AD severity. The additional risk for blood clots was similar regardless of whether the underlying AD was mild, moderate, or severe. Interestingly, we found that additional risk for blood clots associated with AD was higher in older people. Conversely, in younger people with AD, those aged under 45, the additional clot risk was not significantly different from that of the control group. Another high-risk group was people with obesity. The additional risk associated with AD was increased in this group compared with people who were not obese. We found no evidence for risk difference between men and women, and we found no evidence of a greater AD-associated risk in women using estrogen-containing contraceptives or in those with allergic conditions. We have identified that patients with AD have a 17% higher risk of blood clots as compared with matched controls. However, this extra risk is not present in everyone with AD. Younger people, especially those under the age of 45 and those without obesity, have lower AD-associated blood clot risk. These data will help identify people with AD who are at an increased risk for blood clots and therefore will help to guide targeted prevention.